this safety net program in place. We have to have it. We just need to make sure that we're not going to burn it all down while trying to keep this.
That was Representative Jordan Redmond, who led the effort for House Bill 345 this past legislative session. It creates a work requirement to stay on the Medicaid expansion program in Idaho. It passed the Idaho legislature just months ago. Governor Little signed it into law with the intent to prevent a runaway Medicaid budget. Medicaid conversation has not stopped there in Idaho. We know that federal lawmakers are now considering significant cuts to the Medicaid program. The proposed $715 billion in cuts would result in millions across the country losing the coverage that they know right now nationwide, an impact that hundreds of thousands of Idahoans could possibly feel. As Aspen Shumpert learned, Idaho doctors are raising concerns on this, and local cancer care advocates warn the effects of these proposed federal cuts.
There could be an increase in anywhere from 8 to 13 million Americans that become uninsured over this.
Dr. Ted Epperly has been an Idaho physician for 45 years. He says he's seen the effects that come with the lack of insurance.
If you don't have insurance, then you delay care. You don't seek care for minor problems. You don't get chronic diseases managed in a timely way.
Medicaid is a safety net for that, he says, a net more than 300,000 Idahoans rely on.
Typically, most people are at 138% of the federal poverty level. That, for a single individual, is probably right around 20,000, or for a family of 4 at about 40,000. So people in that income level will qualify for Medicaid. And that's an important age group to have coverage for.
Randy LaSalle from Bliss, Idaho, is a single mother, and her 12-year-old daughter was born with epilepsy.
If she didn't have Medicaid, the amount of tests and the doctor's appointments and the medication, I would not have been able to afford it.
Today, her daughter still relies on Medicaid. LaSalle worries for her daughter if the federal government approves the $715 billion cuts to the program.
They need to think about, would they rather lose the dollar and save a citizen, or lose a citizen to save a dollar? Because that's really what they're doing.
If her daughter is cut, they are facing some tough choices. LaSalle possibly needing to get a second job.
You have to choose between, whether your kids are going to be able to do their extracurricular activities, if you're going to be able to get those extra groceries or pay a bill, or if you're going to be able to get to work because you can't afford gas because, well, you got to pay almost $800 a month in insurance fees.
The American Cancer Society Cancer Action Network in Idaho is also sounding the alarm on these cuts. Randy Johnson with the Society and Network says they expect nearly 12,000 people in Idaho will receive a cancer diagnosis this year.
And these are cancer patients, they are children, they are veterans, they are the people that are working down at the Jacksons down the street or at Walmart. These are people we see every day. And just to pluck them and say, good luck, pull yourself up by the bootstraps, that doesn't seem like a very good system.
Johnson says 1 in 10 cancer diagnoses are treated under Medicaid.
That's a scary thought of what we're going to see if these cuts go into place. We're going to see people that don't have access to health care. We're going to see people who are going to get sick, who are going to hear those words, you have cancer, and have no way to navigate that.
Dr. Epperly says these cuts are something every American should be concerned about, not just those in the program.
When you shift that much money out of a healthcare system, what then happens is patients both live sicker, go in later, have high cost. They will not be able to pay for that. Hospitals and providers will not be able to get paid for that. What will happen is the cost shift that will start to raise prices for everybody else. And so having an intact, robust system will actually be the best mitigation to keep people as healthy as possible, but to keep overall health costs as low as possible.
Dr. Epperly wanted to point out is the larger effect this will have on rural Idahoans that depend on Medicaid. They could have to drive further for care or not seek care in a timely manner. Also, if rural providers and hospitals see a decrease in payments into their systems, they could start cutting services. Access could not be as accessible. Both Dr. Epperly and Johnson with the Cancer Society are not against looking at alternatives to improve Medicaid or ways to tackle it, but they really are against this large of a cut.
It's interesting, too. I know that some viewers asked when we had the conversation about state cuts is, well, why are they looking at Medicaid? And, you know, it is a large budget item, and you could hear some people in Congress testify, say, well, would you rather us cut Social Security? So as the federal government is taking a look at cuts, this is an easy one to look at in that sense in terms of it being a large budget. We will see, though, if it actually passes.
Waiting to see what happens with that.
All right. Aspen, thank you so much.